Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This is another one of our Q&A series that's happening on Monday. This is where I answer your direct and specific questions. So if you do have a specific question that is very centered around your situation or what you're struggling with, and you would like to get any of my feedback back, please leave your question below in a commentary, or you can also email your questions. My email is in the bio. Keep in mind, your questions cannot be diagnostic in nature because I don't know your history, so I cannot give you a diagnosis, obviously, nor would it be ethical. But if you do think your question might be diagnostic still, just email it to me. I can always just email back and let you know that I'm unable to answer it on the channel. As long as they're generalized, I can generally answer it. Having said that, excuse me, having said that, I have selected 5 random questions for today's Q&A. As always, I'm blacking out your information to make sure you have your privacy. There's going to be timestamps, as I'm now including them on all of my Q&As, for you to be able to jump around depending on how relevant the topic is to you. So having said that, let's get started. First question for today. How do you separate knowing you are transgender and so desire to be female, but religion, faith, and guilt come into play? That's such a mental struggle that I deal with. Help. Great question. So, full disclosure, I personally am not religious at all. I do consider myself a highly spiritual person, but I just do not ascribe to one religion or another. Having said that, I have had a lot of friends, and I know a lot of people, a lot of trans people, including Cindy Grace Miller, who I interviewed on this channel. I'm going to link the interview below, who has a background in, I think she was actually, I think in the past she used to be a priestess. Would that make her? Is there such thing as priestess in religion? I don't know. But Cindy has a background highly embedded in Christianity, and I do know that for a lot of people, especially when it comes to Christianity, struggling with gender dysphoria becomes a conflict because there's so many people who are spinning. I would say, or I wouldn't say spinning narratives. That wouldn't be accurate to say. What I'm trying to say is this: Bible is highly subjective to individual interpretation because it was written so many years ago. And we have to remember that Bible is really a collection of teachings. And we have to also keep in mind that when the library in Constantinople burned down, a lot was omitted from what is now currently even included in Bible. So it becomes not so clear to interpret things in the Bible today, especially, and to make it applicable to today's situation. For that reason, Bible is interpreted differently across the board, depending on who is doing the interpretation. Having said that, there are people who are interpreting Bible, at least I'm now sticking to religions, obviously, that are subject to biblical doctrine, subject to biblical teachings. There are people who interpret biblical teachings as having nothing to do with transgender people and being very welcome and open and loving to people of different gender orientation and sexual orientations. So it's really up to who is interpreting the religion that you are connected to. I'm assuming most likely you're probably Christian or Catholic, perhaps. Those are the 2 most common religions that tend to conflict. At least a lot of people tend to see it as in conflict with struggling with gender dysphoria and being trans. Religion can be very hard for a lot of people because the truth is you can't just negate your religion. Religion is an important aspect of a lot of people's lives. If you are struggling with gender dysphoria and you're trans and you're also highly religious and you find that your religion or the place where you go worship interprets it in a particular way, I think it could be beneficial for you to explore people who look at it differently. And Cindy talks about it in our interview, and all of her information, all of her social information is down below the interview. She's very open. You can connect to her and you can ask her if there's any other writings or teachings that you can read about. I think there also has been a book published on from Christianity standpoint on supporting trans individuals and how it may be interpreted in a biblical context. So first thing I would do if I were you, I would start looking at different interpretation, because interpretation is interpretation is interpretation. There's many of them. You have to find also the one that resonates and sits with you. I don't believe that if there is such thing as God, I don't believe that God really um, wanted people to struggle with gender dysphoria and not really being their authentic selves. Guilt is going to come into play. I say this again and again and again. Guilt is so common for so many of you. How can it not be when the whole society guilts you into who you are, guilts you even existence, guilts you even into your human rights? So guilt is a different type of thing. It's very difficult. I'm going to link a video below also about guilt and shame. I'm going to make a list here, link Cindy and guilt video for you. That's going to help you. But having said that, I think that if you can broaden your understanding of, at least if you can allow interpretation of Bible that is inclusive of all of humanity and all of the diversity of humanity, I think you would struggle less with guilt and also less with shame. And I think it'll make things a lot easier for you. And it's really easy to struggle. So that's what I gotta say. I wish I had more. I wish I had some quotes, biblical quotes to share where it's all inclusive. But like I said, because I'm not religious, a Bible is probably, even though my husband probably owns a Bible or two, it's like the last book on my bookshelf, to be frank, so I'm not familiar with those teachings. If somebody else is watching this, and if you are religious and you had this conflict and you were able to resolve this conflict, how were you able to resolve this conflict? Comment below, share it with these individuals, so that way we can all help each other here with sharing as much information as possible. Great question. Second question. What about those of us that know we are not trans because I know I identify with my assigned gender at birth, but part of me does not? Growing up and part of my adulthood, I did not seriously consider that I was any other gender than the one I was given at birth until the last year or two. I guess my assigned gender at birth was close enough, and anything that is off is just me being quirky. There's so much conflicting information out there. I'm not sure which information to trust to help sort out where I fit on the gender spectrum. Help. Amazing question, because you're right. There are a lot of people who are comfortable with their gender assigned at birth, but yet starting to develop a little bit of a gender conflict, starting to really question things about the gender, because we're having so much gender information and gender discussion today, just worldly, globally. As a result, it's inevitable that it's going to come into your sphere of consciousness. When new things come into our sphere of consciousness, we always start exploring. And so this is very normal and very natural for people to start exploring their gender. I mean, a few days ago, I was driving and I was thinking, perhaps my gender is more of a non-binary identity. And I had to sit with it, and I had to kind of ask myself inner question and I thought, no, I really do identify with my feminine gender. I really don't see myself as non-binary, even though my gender expression can fluctuate sometimes. Very good question. So how do you know where you land on the gender spectrum? Well, like I say, not everybody who experiences any shred of dysphoria is necessarily transgender or non-binary. What I see missing today from information out there, especially for young adults, I don't know how old you are, but especially if you're a young adult, is helping people understand the difference between gender identity as a core sense of self, gender expression and presentation, and gender role. Very different things that do a lot of times overlap. Gender identity is your subjective relationship to your gender. It is your sense of how you see yourself, especially internally in relationship to yourself. Gender presentation and gender expression is how do you want to express and present yourself in relationship to gender to the world. Your presentation and expression to the world doesn't always have to be what's the word I'm looking for, doesn't always have to be in alignment with your gender. For example, my gender identity is female. Sometimes my gender expression is more non-binary. Sometimes my gender expression and presentation is more masculine. But my gender identity maintains stable, and it is feminine. And no matter how I present in terms of gender spectrum, my core identity maintains to be static throughout the time. The same thing with the gender role. Gender role is what kind of stereotypical roles you tend to engage in as an individual in relationship to gender. There's a lot of stereotypes about masculine gender roles and a lot of stereotypes about feminine gender roles. And we hear people often say that, oh, sometimes I behave like man or I behave like a woman. Those are just roles. People can take on roles again, and it doesn't have to be in alignment with their gender. Roles and your core gender are two different things, but they can be similar if you choose to be, depending on how you see yourself as an individual. This is what I see is omitted from a lot of information out there. It's helping people distinguish between, again, gender identity, gender role, and gender expression. For example, my husband is very comfortable with his gender identity as male. Yet my husband, in terms of gender role, tends to take on a lot of what we stereotypically would call female activities or feminine activities, but it's completely separate from his gender identity. His gender identity is very stable and very strong, and he's very, very feminine in terms of his role, while his gender presentation expression is quite masculine. So this is just to give you an idea how things can overlap, but can all still coexist within the same concept of who you are as an individual. So the best way to figure out where you land on the gender spectrum is the first thing is to figure out if you're having any problems with your gender assigned at birth. And you have shares in here that you are comfortable with your gender assigned at birth. That's a clue. That's a sign. That means that you're comfortable with your gender assigned at birth. Now, you're starting to feel confused and question things about yourself. What are those questions are telling you? What brings up confusion? Are you confused because sometimes you lean toward feminine or masculine activities or activities that are genderless? How does it make you feel? What does it tell you about yourself? Do you feel like you want to change your gender expression presentation, but afraid to do so because feel that it's not in alignment with your gender assigned at birth? Remember, it doesn't have to be in alignment with your gender at birth. So start exploring and start asking you those questions. And it sounds this is potentially more of you trying to figure out what your gender role and gender expression is versus you trying to figure out if you're trans or not. Again, if you're comfortable with gender assigned at birth, that's great. You're comfortable with gender assigned at birth. Then explore beyond just your core identity now into your presentation and into your role. And I bet you're probably going to come up with really good answers. Yeah, good luck to you. Great question. And I'm going to write a blog about this because we're missing this information. And for a lot of young adults today who are starting to question their gender, which is natural and fine, this could really help them figure things out further. Next question, number 3. I feel as if I postpone important life decisions because of not transitioning. I'll be 30 soon. Oof, so young. And I just coast through life. Is this common? I have life goals, but I know they won't feel the same if I lie about who I am. So this is a great question. What do you do? Should you consider living authentically, or should you just continue to go through things? So is this common to not address your gender issues? Very, 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 very common, incredibly common. Is it okay to just keep things afloat? That's up for you to decide. Obviously, lots of people continue to do that and have done so. Addressing your gender issues is not, it's not simple. It's not easy. It's not comforting. It's terrifying. It's overwhelming. It comes with a lot of things. And I don't think that people are going to, I don't see a lot of, at least adults, happily eager to step into things for themselves. I think a lot of people are holding themselves back and manifest a lot of resistance because it's so difficult. And you already said that you feel like you're postponing important life decisions because of not transitioning. This is a very personal question. If life goes on, they won't feel the same if I lie about who I am. Yes and no. A lot of things about yourself are going to be the same. Gender is just a part of who you are. There's a lot of multi-dimensions to who you are. Gender just happens to be just a part. Remember, I always make analogy of a pizza pie. Gender is just one pie of the whole pizza. There's a lot of other elements to it. So you're not really lying about who you are. And I'm not really suggesting for you to take this path. I suggest for you to ask yourself what would make you happier, what would make your life more fulfilling for you, what would make your life more meaningful for you. And if addressing your gender issues and perhaps deciding to do something about it is going to make your life more meaningful, I think, and in my opinion, that is worthwhile to explore. Life is too short. We only have one life. Like I always say, we're on a bus heading to our desk. We don't know where our stop is. So I think you owe it to yourself. I would suggest engaging in therapy with your local therapist to explore all of these questions. Start journaling, start writing, start getting these things out of yourself. Start to really ask yourself those questions. What is it that you want? What is it that matters to you? And you'll be able to get to a conclusion. I wish you all the best, and I hope you pick what works the best for you. Question number 4. Dr. Z, thank you for all you do. You are so welcome. As someone who has followed you a very long time, you have helped me and so many others. Oh, thank you for the heart. How long has this? I was thinking a few days ago, has this YouTube channel been 4? I think it's 4. It can be 5 years. It can be, I have to check the dates, but um, God, I really love engaging with all of you and creating content. And I'm always challenged to think about a new way of presenting to you the multifaceted aspects of gender dysphoria so that you can understand things better for yourself. I'm male to female trans, 70 years old and 7 years into transition. I have been for I have been fortunate enough to have all the surgeries and treatments under the guidance of counselors and doctors following WPATH to the letter. My question revolves around my counselor and my reaction to help with grief resolution, which remains a great burden. There have been some relief from grief and no movement in the last couple of years. So is it time to change counselors, work harder to do what is talked about, or maybe just stop with our meetings? I do not blame my counselor, whom I love, for all the help and guidance through the very dark times of early transition. I blacked out. I already told this person I'm going to black it out because the content is triggering in terms of what they struggled with. My suspicions or my guilt, my fault, is black in progress. So I just wonder if a new approach from another counselor or psychologist would be wise. Okay, so the question is this. I'm fixing my hair. I'm 70 years old. 7 years into transition, has completed all aspects of transition as pertaining to your personal goals, and you're working on grief, and you feel like you're really not getting anywhere, and you're wondering if you should change your counselors or if you should stay with your counselor, or maybe you should just stop counseling altogether. You are suspicious that maybe it's your guilt. Your fault is black in the progress, as in you're feeling resistant to working on your grief. A lot of people work on grief, by the way, post and pre-transition. A lot of people continue to work on multi-elements, depression, struggles, you name it. So this is not that uncommon. Here's what I gotta say. It's, Freud, no matter how much Freud tried to make therapy as a blank slate, it's not. Therapy is highly, highly relational, and it is a two-way relationships. No matter how much input therapy says, it's still relational. We still get to know each other, obviously within the boundaries of confines. There shouldn't be any kind of intimate relationship with you therapist. Um, there shouldn't be any dual relationship with your therapist. There's obviously constraints in place for sure, but nonetheless, it's a relational interaction. How can it not be? You come to a place, you sitting next to a human being, and you tell them your most deepest secrets. You tell them your pain. You tell them your anguish. You tell them things that you perhaps never ever tell anybody else. It becomes a sacred container, and you develop relationship with your therapist. Now, there comes a time when you may have an intuition that whatever it is you're trying to work on is perhaps not getting solved with this particular therapist. And it is common for people, and perhaps this is what you're experiencing, to start feeling guilty about ending treatment, ending therapy, because you've been with the therapist for so long, you love your therapist, you're attached to your therapist. And I said this love in a romantic way, and you feel guilty for leaving them. It's important not to feel guilty. In the end of the day, this is still a service exchange. You're still paying a therapist to help you. Having even said that, we as therapists all have limited capacity to help with certain things. There has been many times when I have told my clients, this is not an issue I can help you with. This is not something I'm good at. This is not something I even have enough adequate training in. You need to go see somebody else. Or I will tell my clients that our work has done. At this point, I took you as far as I personally think I can help you. And now whatever you're struggling with, if you're still struggling with it, you need to try somebody else, because we all have limited, we're not magicians, we're not therapists who know everything and anything. So if your instinct is you're not getting anywhere in terms of a grief work, trust your instinct. And your therapist not only uh, should understand, but most likely will understand if you decide to seek to work with somebody else. Now, whether you should work with another therapist or not, or just drop this matter, is depending on how do you feel about your grief work? Do you feel like it's important for you to resolve it? Not everything needs to be resolved. I don't believe that we need to go to therapy for years and years and years and years and resolve every single issue we carry. That's just not, I don't even think it's good, because then we can quickly become slaves to and dependent on the need for therapy. So you need to ask yourself to what extent you need to even work on this if you want to. And yeah, I think it's totally fine to try another therapist. I think after some time, especially, it could be really great to try somebody new, fresh approach, fresh perspective, fresh way of working. So I would definitely recommend for you to do that. If your instinct is telling you it's not getting anywhere, it's not getting anywhere. Your therapist, I pretty sure will not take it personally. If your therapist takes it personally and gets upset that you decide to discontinue therapy, that's pretty shitty. That's not good. That's not ethical. That's not all right. And that's just not, yeah. But other than that, I wish you all the best. It's amazing you've come such a long way, 70 years old, and completed all aspects of what you set out for yourself in regards to transition. That's wonderful. I hope you're living a very happy and fulfilling life. And I really appreciate you being a viewer of my content for such a long time. Thank you for being there and supporting me. Really appreciate that. So I wish you all the best. Last question for today. How can you make a distinction between gender dysphoria and body dysmorphia or anorexia? It seems of the alteration of your image in your brain. This is a good one. I did a video on this difference between body dysmorphia and gender dysphoria. So one of the easiest ways to tell the difference, and this is very, by the way, banal way to tell the difference, is this. Gender dysphoria is a distress you're feeling specifically in regards to gender. Now, of course, when I say specifically in regards to gender, you're also going to feel distress to your secondary sex characteristic, aka your body parts, right? So, but you're feeling distress how those body parts are being gendered or how they perceive in relationship to gender, versus body dysmorphia is having symptoms or having disconnect with body parts because you don't like, oftentimes you don't like the appearance of them, and oftentimes your appearance is skewed. You have a skewed perception, for example anorexia, where you really believe that you're overweight when in reality you are not. So that's one of the biggest simplest way to distinguish, and like I said, I'll link the videos that goes into details of that. Generally speaking, body dysmorphia and gender dysphoria will overlap. It's inevitable, because once you have gender dysphoria, for example, about particular aspects of your body and how it is being gendered, as you start doing something about it, a lot of people do, they either develop or they start experiencing body dysmorphia, because it is also, especially a lot of trans women I see develop a lot of body dysmorphia because well, you have a natural desire to be very attractive, to be pretty, to be beautiful, all of the feminine aspect that you feel like you were robbed off by not transitioning earlier. So it becomes a little bit of a chasing game of looking good, which is, again, normal and natural. Who wouldn't want to look good? But they do overlap. But again, the easiest way to tell the difference is gender dysphoria is specific. You're looking at, in a video, I give a very simple example of, for example, a female that feels body dysmorphia with her breasts because she feels like her breasts are too unattractive, etc., etc., versus a female that says that I feel gender dysphoria in regards to my breasts because every time I look at my breasts, they communicate to me the genders that I'm not in alignment with, and they communicate to me how society sees me, and it's all gender specific, and that's not how I see my gender identity on the inside. So that's just how to explain. But I'm going to link the video before. Like I said, they can and do overlap. It's important to distinguish the two, but it's also important to realize that one is very, very gender specific, while another one is not. So that's it for today. 5 questions, very good questions. I love it. Very diverse, very different this time. I love getting questions that are just kind of really interesting, and um, I just like to be a little bit not surprised, but I guess not knowing what I anticipate. This is why I blindly select and then just answer them blindly, and it's just, I love doing it. So I really appreciate all of you for posting your questions. Hopefully you love hearing the answers as much as I love recording these videos. If you have specific question for me, please go ahead and link it below. You can also email me your questions specifically. Having said that, please comment and share information, share things about yourself, share what has been helpful, what has not been helpful. When I say share information, it sounds like I want you to share your social security number. I do not. Share just where you at. A lot of you have been with me since the conception of the channel. I have been following and commenting with all of you since the beginning. So by this time, I know a lot of you, and I know a lot of your milestones and a lot of your struggles. So having said that, have a wonderful day, and I'll see you all next time. Bye.